Welcome to ATCM, the Emergency Medicine channel. Today we are going to talk about dopamine. So dopamine is an inotrope. Class of drug is an inotrope. It is an adrenergic agonist. Coming to mechanism of action, dopamine acts via three receptors. One is dopaminergic receptors, that are D1 and D2, beta 1 receptors and alpha 1 receptors. So coming to dopaminergic receptors, dopamine activates these receptors at very low doses, beta 1 receptors at medium doses and alpha 1 receptors at high doses. What is the medium dose, low dose and high dose? It is 0.5 to 2 microgram per kg per minute. This is 2 to 10 microgram per kg per minute, and this is more than equal to 10 microgram per kg per minute. So basically it is low dose, medium dose, and this is high dose. Now what happens is, in case of low dose, which is 0.5 to 0.2 microgram per kg per minute, it will cause renal vasodilatation. It will increase the perfusion to kidney by increasing the blood supply to kidney in low doses. In case of beta 1 receptor activation, it will cause increase in contractility of the heart and the heart rate. That is, it will have a inotropic as well as a chronotropic action. So it will increase the BP in that way. Coming to alpha 1 receptors, that is in high dose of dopamine, it will cause increase in vasoconstriction, that is peripheral vasoconstriction, it will increase, so causing increase in BP. I hope you all can see. Then coming to indications, it is used in AV blocks in bradycardia in symptomatic or hemodynamically unstable AV block or bradycardia, especially when atropine is not useful. Then coming to hypotension or shock, it is usually not the first line of drug in case of cardiogenic or septic shock, usually used in combination with other drugs depending on the underlying cause of shock. Then in inotropic support, especially in severe LV dysfunction, in LV failure with decrease in organ perfusion, dopamine can be used to increase perfusion as well as to increase the contractility of the heart. So it is a good drug in heart failure. Then coming to dosage. Dosage of dopamine is 5 microgram per kg per minute infusion. Maximum dose is 20 microgram per kg per minute. Coming to pediatric dose, in pediatrics it is usually used for hemodynamic support, dose being 2 to 10 microgram per kg per minute, and titrate. Coming to complications, dopamine is known to cause severe tachycardia in patient. So any patient who is having already in heart failure stage, patient can't tolerate increased load on the heart, giving dopamine in such scenarios can lead to tachycardia in such patients and lead to worsening of heart failure. In case of arrhythmias, since it can cause tachycardia, increase in heart rate, it is very much arrhythmogenic. So it can cause arrhythmias like VF, VT, AF. So we should be careful regarding that. It can cause severe hypertension in very high doses. So need to be careful about that, need to monitor BP once the patient is on dopamine. It can cause peripheral vasoconstriction, severe peripheral vasoconstriction, causing decreased supply, compromise of blood supply to extremities, to visceral organs. Then it can also cause extravasation. Coming to contraindications, it is contraindicated in pheochromocytoma in view of sudden hypertensive crisis. It can cause sudden hypertensive crisis, so it is inhibited, it is contraindicated in pheochromocytoma. Then it is contraindicated in patients already in arrhythmias, patient already having VT, AF. In such patients, we do not go for dopamine because it is again more arrhythmogenic. And in cases of hypovolemia, where suppose the patient is in hypovolemic shock, we need to resuscitate with fluid first rather than giving dopamine. This is not a contraindication, but this is something we need to be careful about. Thank you.